My name is Selma Šogorić and I'm professor of public health at Andrija Štampar School at the Medical School University of Zagreb. Today I would like to present you how we develop these community-based approaches towards the healthy aging in Croatian healthy cities and counties. What is unusual that the Croatian Healthy City Network is a non-governmental organization and it's physically located or hosted by the Andrija Štampar School of Public Health with the aim to support the development with academic knowledge and research tool of implementation of the healthy city or healthy county concept into the practice. Healthy aging is the topic that was mentioned since the beginning of the Healthy City project in Croatia, in the city of Zagreb in '87, but officially it's part of the policy document for the first time in the city of Rijeka in 1996. What is the Croatian Healthy City Network commitment is to upgrade our activities to a higher level of excellence. And with that aim, but being aware that comprehensive and integrated strategies are essential in addressing complex challenges as the healthy aging is. We have to build capacity of the local administration to develop this kind of approach. What we want to do in 2015 is to assess efficiency of the existing interventions that are carried out by our members. And we start this research with collecting the models already developed by the cities and the counties. What we're hoping for is to get an overview in what stage of development those projects are. We were hoping that majority of those programs will be in the area of policy, but there are just several examples of policy documents, and majority of the interventions were monocomponent, opposed to the comprehensive programs that we were looking for. And we've been aware that the results will be very different in the programs which are comprehensive or those which are just monovalent. Strategic programs included comprehensive healthy aging policy, and we could find it just in several cities and counties in the Croatia, with very clear aims and objectives and proceedings, and actually the strategy, what kind of services do we have to contract in order to transform local service deliveries. Much more represented were educational interventions, which increase it with the visibility and optimal usage of available resources and services. What is very typical, we have a lot of directories for elderly people where they could find a different form of activities which they could use and similar. There is as well several projects of lifelong learning like University of the Third Age in Rijeka, and many of events and workshops that are aiming at modifying users' behavior, especially in relation to the nutrition, physical activity, and free time activities. A lot of services were direct service intervention in which we use health system services, social welfare system, and civil society, which are actually encouraging the use of, let's say, physical therapy or use of health services, or, for example, accompanying person for people with hearing disabilities. And those kind of interventions are still usually monovalent. They are not connected with the others. So in the conclusion, what to be said is that since our commitment is towards developing a healthy aging policy, with the results of this research, we really try to encourage local policymakers to see the obvious advantages of this way of thinking and acting, because they, with having very clear overview of the needs of different groups of elderly, do we speak about rural elderly or rural elderly living in remote areas, there is a variety of the services that are needed. But it's much better efficiency if we really plan them and the contract delivers of the services very specifically. And that's the only way to improve the healthy aging activities at the local community.